Imagine waking up every single day with the same annoying feeling in your throat, like there's a blob of jelly stuck there that you try to swallow, you try to cough out, but it just won't move. You clear your throat at breakfast, in the elevator, in the pharmacy line, in the middle of an important conversation, and still, that stubborn mucus comes back. People tell you it's your age, that it's normal after 60, that it's allergies, that it's a lingering cold. But deep down, something in you knows it's not normal to live like this. I'm Dr. Emily Carter, and today I'm going to show you the real reason why this persistent mucus won't leave you alone. And more importantly, what no one has explained to you yet about how to get rid of it safely and intelligently. Before anything else, I want you to understand a truth almost no one tells you. Mucus is not your enemy. Mucus is an extremely sophisticated protection system your body has built over a lifetime. It works like a moisturizing film that coats your nose, throat, windpipe, and bronchi. Silently, this protective gel captures dust, viruses, bacteria, smoke, pollution, and stops all of that from reaching your lungs. The problem is not having mucus. The problem starts when that mucus changes behavior. After 60, with the natural aging process, the swallowing muscles get a bit slower. The tiny cilia that push mucus out beat with less strength, and the lymphatic system drains fluids less efficiently. The result, what used to drain quietly in the background, starts to become thicker, slower, and suddenly you begin to feel what used to happen without you even noticing. I want you to think of your body as a city with a very well-designed sewer system. When everything is new, the water flows, the waste is carried away, and nothing builds up. As the decades go by, if the pipes become narrow, clogged, rusty, any little bit of debris is enough to cause buildup. That's exactly what happens with mucus after 60. The production doesn't necessarily increase, but the capacity to clear it decreases. And then, any small irritation, any mild reflux, any slight nasal congestion turns into that thick, stagnant mucus you feel stuck right at the junction between your tongue and your throat. In a moment, I'm going to show you how we start to unclog this system. But first, I need to reveal the hidden cause most people never investigate. Now, I want you to pay attention to a detail in your day that you may have never connected to mucus. You wake up in the morning, clear your throat, cough a little, feel that sticky stuff bothering you. But you don't feel burning in your chest. You don't have that classic heartburn after eating. So you think, I don't have reflux, it must be something else. That's the first trap. There is a type of reflux called laryngopharyngeal reflux, which I like to call silent reflux because it almost never shows up with the symptoms you see on TV. Instead of burning the chest, it comes up slowly, especially at night while you're lying down, and reaches the back of your throat, in the region of the larynx and vocal cords. Up there, even a small amount of acid and digestive enzymes is enough to irritate the mucosa. This irritation is microscopic. You don't feel it burning, but the tissue reacts by producing more mucus in an attempt to protect itself. And it's that extra reactive mucus that you feel in the morning, stuck there like a strip of glue in your throat. The most treacherous detail about this silent reflux is that it doesn't warn you in an obvious way. It shows up as a dry cough that insists on appearing when you talk a lot, or when you bend over to tie your shoes, or right after a heavier meal. It can show up as a lump in the throat sensation, as if a pill were stuck there. Many people describe this feeling as something that doesn't go down, doesn't come up, it just bothers you. Others report patches of hoarseness, difficulty singing, or keeping their voice steady on the phone for long. Most of these people have already taken syrups, lozenges, and even antibiotics unnecessarily because no one investigated that behind the phlegm. There was a stomach quietly sending its contents upward. In a moment, I'll explain how small changes in the way you sleep and eat can greatly reduce this hidden reflux. But first, we need to talk about another villain that drips down from behind the nose. A lot of people associate sinusitis with strong headaches, heavy face, fever, a completely blocked nose. In older adults, however, chronic sinusitis and postnasal drip can be much more discreet. Sometimes, the only clue is that sensation of liquid running down the back of your throat when you lie down. It doesn't always hurt. It doesn't always block your breathing. But during the night, while you sleep, the sinuses release, drop by drop, A thicker mucus that builds up exactly in the area where you feel phlegm in the morning. You wake up, clear it, cough, things improve a bit, but a few hours later, the sensation returns. In many cases, this subtle sinusitis doesn't come from a strong infection, but from persistent inflammation of the nasal lining due to hormonal changes, dry air, mild allergies, or a deviated septum. And there's a mistake I see every day in my office. The person goes to the pharmacy and decides to fix the problem alone with an over-the-counter allergy pill to dry the nose. Drying sounds logical, but in practice what happens is that the mucus that remains becomes thicker, stickier, and even harder to eliminate. If up to this point you're already recognizing parts of your daily life, I want to ask you one thing. Don't pause this video. What comes next may be the missing piece for you to finally understand why your throat is always coated with mucus, even when you feel you're doing everything right. I want to talk now about the medications you take. After 60, it's very common to be on several medications at the same time for blood pressure, heart, joint pain, sleep. Some of these drugs alter the natural functioning of the throat and digestive system. Certain blood pressure medications, for example, can cause chronic dry cough in some people. It's not an infection cough. It's an irritative cough that by itself already injures the throat lining and triggers extra mucus production. Other medications, like some anti-inflammatories, irritate the stomach lining and increase the chance of reflux. And remember, every little episode of silent reflux is like a bath of acid over that delicate laryngeal region. On top of that, we still have the air you breathe. When I ask my patients if they smoke, many answer like this: "Doctor, I only smoke socially, 2 or 3 a day," as if that were irrelevant. Cigarettes, vaping, wood-burning stoves, strong cleaning product fumes, all of that has a direct impact on the health of your respiratory cilia. These cilia are like microscopic little brushes that move mucus toward the exit. Every puff of a cigarette paralyzes those cilia for a few minutes. Multiply that over years and years, and you end up with an internal surface that no longer sweeps. It just accumulates. Add to that the fact that many older adults don't drink enough water. Without water, mucus turns into a kind of thick glue. It's like trying to push honey through a thin straw. The sensation you have is exactly that. Something stuck that won't go down. In just a bit, I'm going to give you a 72-hour plan to start changing this scenario. But first, I need to make an important pause. If you're feeling that, finally, someone is explaining your reality, if several things are clicking in your mind, do 2 things right now. Subscribe to the channel and turn on the notification bell. This isn't just to help my channel. It's to make sure you receive the next video, where I'll show you specific foods and habits that help deflate that throat and reduce mucus without depending on colorful syrups. And of course, leave your like, because that's how YouTube understands that this content is important for people in your age group who are living exactly what you're living. Now let's move into the most practical part, how to start intervening without miracle remedies. The first change I want you to picture is water. Not drink more water in a vague way. Drink strategically. When you wake up, before you even have coffee, drink 2 glasses of water at room temperature or slightly warm. That water will help hydrate the mucus that stayed put all night in your throat and airways. Instead of waking up with a dry, harsh clearing of the throat, you give your body fluid so that mucus softens and starts to move. Throughout the day, don't wait until you feel thirsty. Older adults often have a weakened thirst reflex, so when the mouth feels dry, your body has been asking for water for hours. Small, frequent sips work much better than large glasses all at once. At night, 1 or 2 hours before bed, have another generous glass. You don't need to overdo it and ruin your sleep running to the bathroom, but it's essential not to go to bed with a dehydrated body, because what is thick at night will be a nightmare in the morning. The second change is to turn gravity into your ally. Lying flat, with lots of pillows jammed under your head, is one of the worst combinations for someone with silent reflux and postnasal drip. When you bend your neck too much, the channels get compressed and mucus collects exactly where it bothers you the most. Ideally, you should raise the head of the bed as a whole by a few inches, placing risers under the legs at the head of the bed. This creates a gentle incline for your entire body, not just your neck. That small tilt reduces the chance of stomach contents coming up and also helps nasal mucus drain more easily toward the stomach instead of pooling in the throat. If you can't modify the bed, a wedge-shaped pillow that supports the torso can be a good alternative. Notice that we're not treating the phlegm directly. We're helping the body not to generate so much irritation. The third change is to think of your last meal of the day as either a medicine or a poison for your throat. Eating very late, heavy meals, fried foods, tomato sauce, too much chocolate, coffee at night. All of that increases the chance of silent reflux. If that reflux happens at midnight, you're only going to notice it at 8 in the morning when you wake up clearing your throat. So the connection isn't obvious. That's why you should try to finish your last meal 3 hours before going to bed. Choose something lighter, with less fat, avoiding those foods you already know sit heavy on you, and try cutting back on coffee in the late afternoon and evening. You don't have to quit completely, but testing 2 or 3 nights in a row without coffee after 5 p.m. can transform how your throat feels in the morning. If you have the habit of snacking late at night, think about your throat tomorrow morning before you open the fridge tonight. Now I want you to get to know a simple, inexpensive, and incredibly powerful tool I use with many patients: nasal hygiene with saline solution. Instead of trying to dry out the nose with pills, we're going to wash it. Literally wash it. When you use a warm solution with salt and baking soda, in the right amounts, morning and night, you help remove the thick mucus that sits in the sinuses and at the back of the nose. Over time, the dripping into the back of the throat decreases. Less liquid running down at night, less phlegm piled up at dawn. Some people get scared at first by the sensation of water passing from one nostril to the other, but once they get the hang of it, they start to feel almost immediate relief. Always remember to use previously boiled and cooled water or appropriate filtered water to avoid contamination risks. This practice should be part of your routine, just like brushing your teeth. There's another habit that might be the hardest to break because it's almost automatic: constantly clearing your throat. That little ahem gives a momentary feeling of relief, I know. It feels like it opens up the passage, but every time you do that, you injure your vocal cords a little more, cause micro-inflammations, and make your body produce more mucus to coat the irritated area. It's a vicious cycle. So, starting today, every time you feel the urge to clear your throat, try to replace that habit with 2 actions: a sip of water and a gentle cough with your mouth slightly open without force. It won't be perfect at first. You'll slip and clear your throat sometimes. But as soon as you start noticing this pattern, you're already taking a huge step toward breaking the cycle of reactive mucus. You might be wondering right now, okay, doctor, and when do I need to stop trying at home and see a doctor urgently? That's an essential question. Persistent phlegm without other symptoms is often linked to the causes we're discussing here: silent reflux, nasal dripping, irritants, medications, dehydration. However, there are warning signs that should never be ignored. If the mucus has a very bad smell, a rotten odor if you notice blood mixed in the secretion, if you develop high fever, chills, unexplained weight loss, shortness of breath with small efforts, this is no longer just annoying mucus. These are signs that there may be a significant infection or another, more serious disease behind it. In those cases, the video does not replace a consultation. You need to be examined in person, with a physical exam and, if necessary, imaging tests. Even when there are no red flags, there's another important factor: time. If you follow consistently the guidelines I'm going to propose in the 72-hour plan and still nothing changes, that's a message. Not a message of failure, but a message that the cause is probably more complex and needs to be investigated with endoscopy, nasofibroscopy, or specific exams. The worst thing you can do is normalize eternal phlegm as if it were a punishment of old age. It's not. And at the same time, it's not healthy to keep jumping from one syrup to another without understanding what's behind it. So based on everything I see in my practice, I've put together a small 3-day experiment that you can start today to see whether your body responds when you remove some triggers. On the first day, I want you to focus on 3 pillars: water, sleep, and nose. Early in the morning, start with 2 glasses of warm water on an empty stomach. Throughout the day, set a realistic goal of at least 2 liters of fluids, counting water, caffeine-free teas, and light broths. In the late afternoon, reduce or eliminate coffee. At dinner time, have a simple meal: No heavy fried foods, no overload of tomato sauce, and don't eat until you feel stuffed. 3 hours later, go to bed with the head of the bed slightly raised. Before lying down, do your first nasal rinse with warm saline solution. Take a deep breath, sleep, and when you wake up the next day, honestly observe the texture of your mucus. Don't expect miracles, but look for small changes. Is it a little less thick? Did you start clearing your throat a bit later? Is the cough less harsh? On the second day, keep those habits and add awareness around throat clearing and a small swallowing exercise. Every time you catch yourself clearing your throat without thinking, stop, take a sip of water and try to swallow instead of scraping. After brushing your teeth, do a sequence of intentional swallows, slowly swallowing saliva and feeling the movement in your throat 10 times in a row. It sounds too simple, I know. But this exercise helps recruit the swallowing muscles again, which, with a sedentary lifestyle and aging, get a bit lazy. More active muscles help pump out accumulated mucus. During the day, also pay attention to your environment. If you spend a lot of time in an air-conditioned room, consider using a very clean humidifier for a few hours. If you still smoke, the ideal would be to stop completely, but at least during these 3 test days, reduce it to the absolute minimum and watch how your body responds. On the 3rd day, if there are no previous medical contraindications, you can talk to your doctor about the possibility of using a mild mucolytic, such as N-acetylcysteine, for a short period, always under guidance. The idea is not to depend on medicine forever, but to give your body a little push to liquefy the mucus while you adjust your lifestyle. Keep up with the water, the elevated head of the bed, lighter dinners, nasal hygiene, swallowing exercises, and the conscious effort to abandon compulsive throat clearing. On the 4th day, make an honest evaluation. This is not about noticing a total cure, but about identifying whether there is any sign of improvement. Less need to clear your throat, less feeling of something stuck, less dry cough when speaking. If there is, great. That means these functional causes play a major role in your phlegm and can be worked on. If there isn't, it's time to bring this as valuable information to your doctor and say, I've already made these changes and nothing has changed. Can we investigate deeper? Before we finish, I want to quickly break down a few myths that are circulating out there and slowing down your recovery. The first is the famous, any cough syrup will do. Many syrups only relieve the sensation. Some contain a lot of sugar. Others just make you sleepy. Without enough water, they turn into expensive gel instead of really helping. Another myth is that milk creates mucus out of nowhere. What can happen is that in some people, the protein in milk makes the existing mucus feel thicker, but that's very individual. It doesn't make sense to blame a single food without looking at the bigger picture. Hydration, reflux, sinusitis, medications. And there are also the natural remedies loaded with sugar and concentrated lemon that irritate the mucosa and dehydrate the cells in your throat. A good remedy is one that takes your body's physiology into account, not just a pleasant taste or a family tradition. Let me tell you, to wrap up, the story of a patient who could easily be anyone watching this right now. Let's call him Mr. Antonio, 72 years old. He came into the office saying that for almost a year, he had been waking up with phlegm in the throat that made him cough so much his wife would wake up too. He had already taken 3 types of syrups, 2 antibiotics, nasal sprays, and nothing worked. He was already convinced it was just age and that he'd have to accept it. When we sat down to talk calmly, we discovered that he ate dinner very late, loved a big plate loaded with tomato sauce, drank coffee until 9 at night, and slept on 2 high pillows, almost sitting up. On top of that, he was taking a blood pressure medication known to cause dry cough in some people, and spent the entire afternoon in a closed room with very strong air conditioning and no humidifier. No one had ever explained to him that all of this added up. We didn't start with yet another syrup. We started with a plan very similar to what I've just shared with you. We adjusted the schedule and type of dinner, repositioned the bed, spoke with his cardiologist about testing a different blood pressure medication, introduced nasal hygiene, and an organized hydration routine. 2 weeks later, Mr. Antonio came back saying, "Doctor, for the first time in months, I went 3 nights in a row without waking up to clear my throat. There was still some mucus, but it no longer controlled his life. Over time, we made fine adjustments. The message from his story is not that you should copy exactly what he did, but that phlegm is not a life sentence. It's a warning. When you listen to that warning carefully and look for the cause, the path to relief becomes much clearer. If this video helped you better understand what's happening with you, don't keep it to yourself. Leave a comment telling me how long you've been dealing with this stubborn mucus and what you've already tried so far. I read the comments and used these real stories to plan upcoming videos. Also share it with that friend or family member who is always clearing their throat and is tired of hearing that it's normal for your age. And of course, hit the like button, subscribe to the channel, and turn on notifications. In the next video, I, Dr. Emily Carter, will go deeper into how to choose anti-inflammatory foods and habits specifically for your throat after 60, so you can go back to talking, laughing, and singing without feeling like something is always cutting you off. Your voice deserves freedom, and you deserve to live without that constant weight in your throat.